You might be wondering, can a stellate ganglion block help with hot flashes? Maybe you've heard of this treatment for PTSD, but what about menopause? I'm Dr. Ko at Reset Ketamine in Palm Springs, California, and today I'm going to share with you how stellate ganglion blocks may be a non-hormonal option for managing hot flashes and night sweats, especially for those who can't or do not want to take hormone therapy. What are hot flashes and why do they happen? If you have ever had a hot flash, you know the drill. A sudden wave of heat, sweating, and flushing that comes out of nowhere. Over 75% of menopausal women experience these symptoms, but the cause is not fully understood quite yet. The leading theory is that estrogen fluctuations affect how your brain regulates temperature. Changes in norepinephrine and serotonin levels can throw off your body's internal thermostat, making you more prone to sudden sweating and flushing. So what are the common treatments for hot flashes? Well, most doctors recommend one of two treatment paths. First, hormone replacement therapy, HRT. It can work well for many people, but isn't suitable for anyone. Or they may be on hormone replacement therapy, but it's not quite as effective. Those with a history of breast cancer or blood clots could be at certain risks associated with HRT. The other treatment path are non-hormonal medications, which includes, but not limited to, clonidine, which may help reduce norepinephrine release, as well as SSRIs and SNRIs, which can help regulate serotonin and norepinephrine. But what if hormone replacement therapy isn't an option or you don't want to take the medication? And this is where the stellate ganglion block comes in. So what exactly is a stellate ganglion block? It's a simple outpatient procedure where a local anesthetic is injected into the stellate ganglion, which is a cluster of nerves in your neck. It was originally used for chronic pain and PTSD, but now researchers are seeing promising results for treating those with hot flashes. So how do stellate ganglion blocks work for hot flashes? Simply put, the stellate ganglion is a part of your body's stress and temperature regulation system. If you've ever started sweating during a stressful situation, that is your sympathetic nervous system at work. The SGB temporarily blocks this response, helping to reset your body's temperature control. And the result? Well, fewer and less intense hot flashes. At this point, you may be wondering what the procedure is like. So here's what to expect. You're going to be lying down comfortably while a doctor injects a local anesthetic into the neck. We use an ultrasound to ensure precise placement for maximal safety and effectiveness. The entire procedure takes roughly 10 to 30 minutes, kind of depending upon the anatomy. And after the procedure, some temporary effects will happen and are normal. So you may have something called Horner's syndrome, which is a temporary droopy eyelid, some mild hoarseness of the voice, a smaller pupil, nasal congestion, and maybe even a headache. All of these symptoms typically resolve within 4 to 8 hours. So should you get a stellate ganglion block for hot flashes? Well, you might be a good candidate if you've tried hormone replacement therapy without success, if you can't take hormone replacement therapy due to medical reasons, if you've had side effects from traditional treatments, if you want a non-pharmacological option, and you may also have PTSD since stellate ganglion block is widely used for PTSD treatment. But the stellate ganglion block is not for everyone. You should avoid this procedure if you've had a recent heart attack, if you're on blood thinners or have a bleeding disorder, if you have glaucoma, pre-existing nerve damage, or certain heart conditions. If you're unsure, please talk with a SGB specialist to see if this is a right fit for you. Stellate ganglion blocks are gaining traction for PTSD treatment, but now we are seeing a growing body of research supporting them as an alternative complementary therapy for hot flashes. If hot flashes and night sweats are affecting your daily life, you deserve options. While this treatment is promising, it's not a one-size-fits-all solution. Your medical history and personal needs should always come first. If you're curious about whether an SGB could work for you, best next step is to talk with a specialist near you. Thank you so much for watching, and if you found this helpful, be sure to like and subscribe, and I'll see you in the next video.